Hello, today we're going to be talking about taking blood pressure manually. And first off, you want to come in the room and you introduce yourself to the patient. After you introduce yourself to the patient, make sure you look at her directly, speak slowly and loud clear. And you tell her today we're going to be taking your blood pressure, okay? And make sure it's the right person also that you are having in your chart report. And then first you want to go wash your hands for 20 seconds. After you wash your hands, you come back and then you make sure she have her privacy. You close the blind, make sure the window's down, and then you fix her up correctly, making sure if she's laying down she will be up and her arm will be at her heart level. And if she wants more support, you can put a pillow under her arm to make sure that her arm is right at the heart level. After that, you want to lock the bed, and then you want to feel for the the brachial artery, which is the inner part of the arm, using 2 fingers or 3 fingers. After that, you want to make sure you get the alcohol wipes. You clean this part, the diaphragm, and then you flip it over to clean the ear part of your stethoscope. You want to put her cuff on, making sure it is nice and fit. And you want to make sure that if this is her right arm, you might want to have the arrow pointing down at the brachial artery. You want to put this in your ears and have this light right where the brachial artery is when you want to listen to her pulse. And when you do this, you want to close this little one right here. You want to close it all the way, but not too tight. You want to pump it up to about 160 to 180, okay? When you hear a beat, immediately deflate it and then pump it up to about 200. The first sound you're gonna hear is how the you wanna remember the first beat pulse you hear and the last beat that you hear. Slowly inflate it. Another way. Before you want to write it down, you make sure that you take it off. Make sure that she's right back at where she was, the position she was laying in before, and making sure the bed is locked, everything is safe before you go and write it down. So you want to unfold the blind up the window, and then you go wash your hands, and then you can go record that. Okay?